3 days ago, I tested for COVID, and after a day, the results came back. It's COVID. Hi everyone, my name is Savannah, and I was diagnosed with COVID. I thought it would be very beneficial to create this video to help some of you understand what to expect if you do get COVID. So I was diagnosed with COVID on the 26th of December, so Boxing Day. The result came back and I was positive, which was very unexpected. I'm generally someone who is really freaked out about germs. I have had a hand sanitizer, a wall-mounted hand sanitizer for years before COVID even existed. So that was the first reason why I was a little shocked that I tested positive. The second reason is that my symptoms weren't any different to the common cold. The first symptom I experienced was on the 17th of December, and that was a very vague symptom. I felt really tired and I had a slight sore throat. After about 2 days, I started getting a cough, I got a headache and felt really congested. I didn't know this, but there are people who volunteer to help people with COVID with their groceries and getting anything from the pharmacy or doing anything that a person with COVID can't do because of self-isolation. That was very, very nice to know about. Luckily, we didn't need any of that help. We were able to get all our shopping online. In terms of medication that I've taken or any home remedies to help with the symptoms, sorry. So in terms of home remedies, as an ex-pharmacist, I try to avoid taking drugs unless really need them. I did have headache and I had sore throat, but the pain wasn't severe enough to take anything. I think honey was my best friend. Honey was just really soothing, and it has antiseptic properties, which was great if you have an infection like COVID or any other viral or bacterial infection. We also had lots of ginger mixed with honey, and it burns like hell, but it does soothe the throat and just makes you feel better overall. Plenty of fluids and lots of soup. That was it. So I'm 29 and I have no underlying health conditions, and my symptoms were very mild. They were identical to a common cold, which was very fortunate for me. However, it's very important to self-isolate correctly when you do have the virus, because even though you may be asymptomatic or have very mild symptoms, you're very contagious when you do have coronavirus, and that can spread to people who are vulnerable, and it would be the worst feeling to know that you're the reason why someone experiences serious harm as a result of COVID. Today is, Alexa, how many days has it been since the 17th of December?
December 17th fell on a Thursday 12 days ago.
Okay, so today is day 12. I feel perfect. I have so much appreciation for feeling healthy again. Even though my symptoms weren't severe, it was scary to be tagged as having COVID. The only symptom I currently have is a cough. It's a productive cough, so it's not a dry cough for me. I know some people have dry cough when they get COVID. For me, it's very productive, so I'm producing mucus, clear mucus. My partner has a dry cough instead of a productive cough, and the main difference between my symptoms and his is that he's lost complete sense of taste and smell. I haven't. I can still smell and I can still taste. Me and my partner probably have the same strain of the virus. Our symptoms are completely different. The main points that I'd like to share with you that I have learned from the research I've done is that COVID has an incubation period of about 14 days. Now that's the period from when you're first exposed to the virus to when your symptoms appear. On average, symptoms appear about 6 to 7 days after exposure to the virus. So at any point you could be a carrier of the virus and you're infectious. You may not have symptoms, and the 3 days prior to developing your first symptom, according to research, that's the most infectious period. The very first 7 days after you experience the first symptom, those are considered very contagious as well. Going back to my symptoms, the very first thing I noticed was tiredness. I was very tired. I had no energy. I'm currently doing a coding boot camp, and on Friday the 18th of December I couldn't focus. I had no energy whatsoever to do anything. I had a slight sore throat and I decided to take the day off and just take a rest. A few hours later, I developed a cough and I was very congested, so I felt I had a blocked nose, headache, nothing unusual. All symptoms of the common cold. The following day, things got worse. The third day, things were kind of the same. I wasn't improving. But at the same time, the symptoms were very minor. They weren't severe. So in terms of where I caught the virus from, it's very hard to tell. There are so many different possibilities. It's almost impossible to tell how you got the virus. In my case, I think it was from a restaurant outing, but again, there is no evidence and there is no way I could pinpoint the exact time and location I got the virus. Symptoms, in my case, I was very lucky. My symptoms were minor. It was just cold. It was like a normal cold. We got the test done on the 26th, 9 days after I developed my very first symptom, and the results came back the following day and we were positive. Soon after that, the NHS Test and Trace were in contact. They wanted to know where we had gone, who we had come in contact with for the 7 days prior to me having my very first symptom. I think the biggest victim is our poor dog, who hasn't been able to interact with her friends. She loves playing with other dogs, and she hasn't been able to see any of them or play with any of them. But yeah, I hope you found this somewhat useful. This is purely a record of my experience with COVID. I am 29 years of age and I have no underlying health conditions. I hope you've enjoyed this video. I've been trying to do new things with my time since I've been self-isolating, and creating a YouTube video for the first time was one of the things that I tried to do during this isolation period. So I hope I was somewhat useful for you all. Thank you. Stay safe and have a happy new year.